So, what we're going to talk about is common questions, common concerns that I hear a lot in my 5+ years working at WIC as a peer counselor. First one is weight gain. As I explained earlier, breast milk has fats in a different category than formula. Breastfed babies sometimes take up to 2 weeks to regain their birth weight. It's important to remember that if you are in labor and you are getting a lot of saline, which is going to make you puffy, it does get to your baby through the umbilical cord while you're pregnant, and it's going to make them puffy. So they're going to be retaining a little bit more fluid. So having your baby go back to that, and then you're working off of their fat reserves, it's going to change the way your baby weighs. At WIC, we look for growth curve gain, not your baby's this old, it should weigh this much. It's important to know that because breastfed babies do gain weight differently, it needs to be addressed that humans come in all shapes and sizes. Some people are shorter with large bodies, some people are shorter with small bodies, some people are very tall with large bodies, some people are very tall with small, short, thin bodies. We want to make sure that your baby has its own growth curve. If mom is a medium person with a medium build, dad is a tall person with a thin build, but grandma and grandpa were small people with large builds, genetics plays a key role. Baby just needs to be gaining weight according to their developmental age and their body type. Second of all, if we have problems with breastfeeding, breastfeeding should not be painful. If it is uncomfortable, please come to the WIC office. We have plenty of people here trained to make it comfortable. The best thing to do, though, is to make sure your baby has good, positive experiences with it. Having someone try to pry your baby's mouth open and taking you and trying to push it all together is not a good experience for either of you. Knowing that it takes your baby time to learn how to do it is important. Sometimes your baby is just tired and they're just like, I am literally 36 weeks old, so I am not going to be as effective as a baby born at 40 weeks. So you will have to massage the milk into a spoon and then spoon feed your baby. The global health media videos are very important because it shows spoon feeding. It shows cup feeding. If a woman in a third world country without all the pumps and the gadgets and the doodads can do this, so can you. So can you. Okay? Now, it's important to know that some women get clogged ducts. A clogged duct feels like a hard, pea-like lump in the breast. Take your tongue, stick it to your cheek, and touch it on the other side. That is what a clogged duct feels like. If you have that lump in your breast and you are not pregnant or lactating, go to the doctor. If you are lactating and you have that, that mostly means that there is a clogged milk duct and we have to work it out. To do that, first we need to warm the breast up to make things move. Then we want to do massage of the breast, everything direction of the nipple. Now you can latch your baby, nose in the direction of the lump, because the breast is round, 360 degrees of latching potential. And if you are not able to latch your baby, you can use a pump. We want to either pump, or we can use a Hako or a silicone style breast pump. Roll it down, squeeze it, and then have your lump, if your lump is here, put this on the breast and then massage it down. You can then do some breast compressions, which is like this, to kind of help. If you have a clogged duct that does not move, you can risk a breast infection. A breast infection is showing streaks, cold-like, flu-like symptoms. There are things you can do, medicine you can take. Speaking of medicine, It is very easy for someone to tell you you can't do something because you're breastfeeding, because that alleviates their responsibility. A lot of things are safe for breastfeeding. If you have a question, call your WIC office and we can look it up in the Hales manual. We can let you know if it's a level 2, safe for breastfeeding. If it's a level 5, no, do not find alternate ways to feed your baby. We can tell you at what dosage is safe and what dosage is not safe. Ibuprofen, level 1, extensive data, you know, it says moms are taking 400 milligrams every 4 to 6 hours. You know, we can look it up here and we can help you make informed decisions. If you don't know if somebody has this, you can go to infantrisk.com. They are the people who write the book, and you can get help with your medications. Their 1-800 number on their website, infantrisk.com, is staffed by registered nurses who can help you make informed decisions. Now, that being said, one of the things I noticed before is I did not mention how quickly it takes the breast to fill back up with milk. It takes 20 minutes from the breast to feel empty to fill back up with milk. Your breast should start feeling like it's a water balloon when it's time to feed your baby. At the end of a feeling, it should feel like someone took that water balloon and laid it in the sink and all the water splurted out. It should feel deflated. When it starts to fill back up, then it can go full deflated. The more you move the milk out of the breast, the better. Please turn it off.